Do you frequently feel like something is not quite right unless things are perfectly arranged? Or do you wash your hands over and over even when they're clean? If yes, you might be surprised to know that these behaviors could be signs of something called Obsessive-Compulsive Disorder, or OCD. OCD is not just about being neat or careful. It's a real mental health condition where a person gets stuck in a loop of unwanted thoughts, obsessions, and feels the need to do certain actions, compulsions, to feel better. For example, someone might think, if I don't check the stove 10 times, my house will burn down. So they keep checking it, even though it's already off. These habits take up a lot of time and cause stress. But the good news, it's treatable. So what causes OCD? It's not just one thing, it's like a puzzle with many pieces. Some people are born with brains that are more likely to develop OCD. That's genetics. Think of it like inheriting your mom's eye color or your dad's laugh. But instead, it's a brain pattern that overreacts to fear or mistakes. Brain scans show that in people with OCD, the part that says something's wrong doesn't turn off easily. Also, life experiences matter. For example, if someone goes through a scary event, like a serious illness or bullying, their mind might start using rituals to feel safe. Even infections in rare cases, like strep throat, can suddenly trigger OCD in children. So, it's a mix of genes, brain wiring, and life events, not just bad habits or being dramatic. Let's play a quick game. Raise your hand if you've ever gone back to check if you locked the door. Okay, most hands down. Now, keep your hand up if you checked it 5 or more times and still doubted. That's closer to OCD. Signs include obsessive thoughts, like constant fear of germs, harming others, even if you'd never do it, or needing things perfectly aligned. Then come compulsions, actions to ease the fear. For example, Ali brushes his hands 30 times a day because he fears being dirty. Rena erases and rewrites her notes until they're just right. These actions don't feel good, they feel like a must. People with OCD often know it's too much, but feel powerless to stop. It's like a mental sticky note that won't peel off, no matter how hard you try. How do doctors know if it's OCD? There's no blood test. Instead, they talk, a lot. They ask about your thoughts, habits, and how they affect your life. It's not about judging, it's about understanding. To be diagnosed, the obsessions and compulsions must take more than an hour a day and mess with daily life, like school or relationships. Treatment, 2 main tools, therapy and medicine. The best therapy is called CBT, specifically ERP, exposure and response prevention. That means slowly facing your fear without doing the compulsion. For example, touching a doorknob and not washing hands. It's scary at first, but the brain learns, oh, I didn't die. Maybe I'm okay. Medicines like SSRIs can help reduce the mental noise. With time, most people feel much better, not perfect, but free to live. Can we prevent OCD? Well, we can't change genes, but we can protect the mind. Think of it like wearing a helmet while biking. You can't stop all accidents, but you reduce the damage. For kids, teaching healthy coping skills early helps. For example, instead of giving in when a child insists on retying shoes 10 times, gently say, let's try just twice today. Building emotional strength, managing stress with breathing or journaling, and talking openly about fears can stop small worries from growing. Also, avoiding harsh criticism helps. Shame worsens OCD. Prevention isn't about stopping at 100%, but creating a mind that bounces back faster. Scientists are digging deeper into OCD every day. One cool advance is using brain imaging to see OCD patterns and target them with precision treatments. Some studies are testing a treatment called TMS, transcranial magnetic stimulation, which uses magnets to calm overactive brain areas, like a soft reset button for the mind. Another exciting area is digital therapy, apps that guide ERP exercises on your phone, making help easier to reach. Researchers are also exploring how gut health and inflammation might affect OCD. Yes, your gut bacteria could be whispering to your brain. One recent trial showed that some OCD symptoms improved with specific probiotics. It's early but hopeful. The goal, more personalized, fast-acting treatments with fewer side effects.